everyone, my name is Casey Amarda Tombo from BSN 11I and your student nurse for Davao Doctors College. And today I am going to demonstrate the eye assessment. So most of our people consider vision as the most important sense. So in this case, I am doing the eye assessment. It will help us determine if the patient has any abnormalities in his prohibition. So now, the first thing to do is that to review the client's medical record if available, but my patients didn't have any previous medical records because this is her first visit. And then, second is determine the scope of assessment. This is done for you to know the extent of assessment and of course, prepare the necessary equipment such as this Snellen chart, the black ball pen, the pen light, the opaque card. The third is I'm gonna need to perform hand washing to protect my patient and myself from infection and cross-contamination. Introductory phase. Number 4. Greet the client politely. Introduce yourself to the client. Identify the name of the client using the two identifiers. Basically, we'll be asking the name of the client, we'll be asking the birthday of the clients, and you will be compare it with the bracelet or to the ID band of the clients, and also ask the client what he or she would like to be called during the assessment, and also establish rapport to the client. This is done in order for you to verify if you have the correct clients and also to establish rapport with the client. Good morning, ma'am. I am Kaysa Merlatombo, your student nurse for today, and may I see your hand, ma'am? Please state your name.
Ludiana Tombo.
And what do you want me to call you?
Ludi.
Okay, ma'am. Thank you. Number 5. Explain the procedure to the clients and how or she can participate during the assessment. Provide the clients the opportunity to clarify, ask, or raise any concern. Today, I'll be doing the eye assessment. So, I am going to check how clear and how good your eyesight. And of course, check if there are a certain spot or angles at which you have trouble seeing. Okay? So, during the conduct of the assessment, I might need to ask you to stand up, to sit down, to read something, or shine light in your eye. Okay? And of the result will be documented, but it will be kept confidential. Will that be alright?
Yeah.
Okay, do you have any question or clarification perhaps?
No.
Okay, thank you, ma'am. Number 6, ensure the client's comfort, privacy, and confidentiality. Make sure that the assessment setting is secure, safe, and free from distraction, and also have to position the clients in the comfortable setting position. This is done in order to provide comfort to the patient while the assessment is going on, and also to provide dignity and to have any interesting relationship with the patient. So before we start, it is okay to you if I close the door so that no one from outside will be able to disturb you while doing the assessment. Is that okay?
Yes, ma'am.
And are you comfortable? Is the room temperature?
Yes, ma'am.
Okay. Number 7. Check for any use of visual aids prior to starting the test. This includes your lenses. You have your glasses. Make sure to check them because if the client has lenses or glasses, make sure the clients wear them during the test. But if the client has reading glass, make sure to remove them during the test because it can cause blurring of vision. I may just ask, do you use any contact lenses or graded glasses? Okay. Number 8. Have the client stand 20 feet or 6 meters from the Snellen or E-chart. Cover the eye being tested and ask the patient to read each line until she or he cannot decipher the letters of their directions. So now I'm gonna ask you to stand up, Ma'am Ludi. Okay, so what I use you to do is to use the OP card to cover your right eye first and try use the letters that are written with the Snellen chart. Just up until the letter that you can still see, okay?
Okay.
And then after doing that with your right eye, uncover right eye cover. You have to do it again with your left eye cover. Again, and for the third part of the procedure, I use you to use the letters in the Snellen chart with your both eyes uncovered. Okay?
Okay.
Number 9. Talk 3 reading right eye, left eye, and both eyes. Okay, Mom, first, cover your right eye and read the Snellen chart.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E Z.
Okay, Mom, and again, your left eye.
E F P T O Z L P E G P E C F D E D F C Z P F E L O P Z D D E F P O T E C.
Okay, Mom, and uncover your both eye. Please read the Snellen chart.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T Z E T E S.
Okay, Mom, thank you. You can sit now. Number 11. Perform the selected vision test, light perception, hand movement, then counting fingers if necessary. If the client is unable to see even the top line, 20 to 200 of the Snellen type chart. Okay, Mom, I need you to tell me how many fingers I am raising, okay?
Okay. 1, 2, 3, 5, 4.
Okay, so another is I need you to tell me what direction I putting my fingers, okay? Right.
Right, right, right. Up, down, left, right.
Okay. Mom, I need you to tell me if you could see the light. Okay, Mom?
Okay.
Where's the light, Mom?
Left,
Okay.
Up, right, down.
Okay, ma'am. 12. Face the patients directly at a distance of 60 to 90 centimeter or 2 to 3 feet. Number 13. Instructed the clients to look directly into the examiner's eyes with both eyes. Number 12. Place the hands about 2 feet apart, lateral to the patient's ears. Number 15. Slowly moves wiggling fingers of both hands along the imaginary bowl over the patient's head until the patients identify them. Okay, ma'am. So now, what I need you to do is just to look straight into my eyes, okay? And tell me, say the words, okay, if the first part of my fingers is you're entering your visual field. Okay, like this.
Okay. 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 Okay.
Ma'am. Number 17. If a defect is detected, slowly move wiggling fingers from the defected area of the field toward the better vision. Repeated this at the several level until the border of the defect has been defined. Number 18. Tested other eye for an accompanied defect. Okay, ma'am. Someone you have a trouble seeing with your right eye, so let's do the wiggling again first. And tell me, say the words, okay, when the first part of my fingers is entering your visual field, okay?
Okay. 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 Okay.
Okay, ma'am, let's do it with your left eye.
Okay. 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 Okay.
Okay, ma'am. Number 19. Visually inspected the eyes of alignment and symmetry. Number 20. Inspected the eyebrows for the hair distribution and alignment, and skin quality and movement. Ask the client to raise the lower and the eyebrows. Number 20. Inspected the eyelashes for evenness and distribution and direction of curl. Number 22. Inspected the eyelids for surface characteristics, skin quality and texture. Position is in resolution to the cornea, ability to blink, and frequency of blinking. Inspected the lower eyelid while the client's eyes are closed. Number 23. Inspected the area over the lacrimal glands and lacrimal sac for the swelling. Number 24. Ask the patient to look up. Depress the lower lid of the patient with one's thumbs afterwards to assist the sclera and bulbar conjunctiva. Number 25. Inverted the eyelid to assist the palpebral conjunctiva. Okay, proceeding now, I'll be checking your eyes. So first, workers, I see that your eyes are aligned and symmetrical, and your eyebrow are evenly distributed and slightly arched. So can you raise your eyebrow for like this and down like this? Okay, and then your eyelashes, they are both evenly distributed and curl are slight, and they are curl slightly upward. Okay, so you can close your eyes. Okay, and no discoloration. Okay, and you can open your eyes. Okay. So I'm going to palpate your nasal lacrimal duct and lacrimal gland. Okay. Okay, and no edema, no swelling, no tearing of your lacrimal duct is good. and your please look up. Okay. Okay. And all right, now I'm going to be inspecting your iris and pupils. So just look up straight into my eyes. Okay, and I am going to use my pen light to check it for your area and lenses for any opacities. Okay. Okay, there is no opacities. So now I need to close the light. Okay, so now I'm gonna need to shine again on my pen light in your eyes to check for your direct and consensual reaction of your pupils. Okay. Okay, and very good. So what I did is I shone light in your right eyes, and then it's constricted, and that's the dark reaction. And for the consensual, it seems that when I shone light in your right eye, the left eye also constricted, which is pretty normal. Number 31. Held an object, a pen light or pencil, about the 10 centimeter from the bridge of the client nose. Number 32. Ask the client to look first at the top of the object and then at the distant object. The far wall. Behind the pen line, instructed patient to alternate the gaze from the near to the far object. Observe the pupil response. Number 33. Ask the client to look at the near object and then move the pen light or pencil toward the client nose. Proceeding now to the assessment in your pupils' reaction to accommodation. So what I used to do is to look or pans your eyes at the tip of my pen light, then look at the hole at my back. Okay? So look at to the tip of my pen, then at my back, and then to my pen, again at my back. Okay. Number 34. From about 2 feet direct in the front of the patient, shine a light onto the patient's eye and ask the patient to look at it. Number 35. Inspected the reflection in the corneas. Number 36. Look for direct and consensual reaction. So now I'll be performing the Herzberg test. Okay, so basically I'm just gonna shine of my pen light in your eyes and then look for the reflection of it in your corneas. Okay? Okay. So just look the straight. Look straight. Okay. Okay. So now I'll be performing the cardinal field of gaze test. Okay, so I need you to follow the tip of my pen light. Okay, with your eyes only, and do not move your neck. Only your eyes. Okay, just follow this. Okay. Okay, now I'll be testing your convergence. Simply just follow the pen, okay? Okay. Now, ma'am, I'll be summarize everything that we've covered. So, for your visual activity, when you were reading the Snellen chart, the result was your right eye vision is to 20 over 25. Okay, and then your left eye is 20 over 30, and both of your eyes is up 2 over 20, means all goods and normal. Okay? And for your visual field, the one which I did, and I was wiggling my fingers, and then you said, okay, it has, if you spot my fingers in your visual field, so you can, so you up your upward field is at 50 degrees downward. The downward field at 70 degrees, and then your nasal thread at 50 degrees, which is normal. Okay, so for the inspection of the eye, are aligned and symmetrical. The eyebrow are evenly distributed, and orange eyelashes are evenly curled upward for the eyelid. Skin is intact, lid glow symmetrically, and no blink per minute. Okay, and so as I was palpating for your lacrimal glands and nasal cranial duct, nasal lacrimal duct, there was no edema, no tenderness, no swelling or fury. Okay, so sclera is white, so which is normal, and your vulvar conjunctiva is good. And iris and pupil are both normal, no opacities, and the pupil is all 3 millimeter, which is normal too. So your pupil reaction to accommodation is normal too. The one that we did when we are looking at the tip of my ball pen is for your look at the wall, that's the accommodation. And cardinal field gaze test, both eyes are coordinated, no jerky movement, so everything is normal. Okay, ma'am, thank you for your cooperation.